Hello everybody, today we're going to be talking about meningitis, specifically bacterial meningitis. Here's a quick overview of everything we'll be discussing, and I'm going to start out with the case study. Lei Kealoha is a 21-year-old female living in the dorms. She has no significant health history and hasn't seen a doctor since the age of 15. She binge drinks socially on the weekends with occasional recreational marijuana use. Lei started feeling sick Sunday morning with fever, chills, and a headache. She was told by the health center to take Tylenol until she was feeling better, but if she wasn't feeling better in 1 to 2 days, she needed to go to the urgent care or the ER. The next day, Lei had the same symptoms with the addition of a headache and a sore neck. In the afternoon, Lei was beginning to act confused around her roommates, who then decided to take her to the ER. While in the lobby, Lei started convulsing and was quickly rushed to the ER's code room. After a full workup in the ER, lab work, CT scan, and lumbar puncture, it was determined that Lei had meningitis.
Due to swelling in her brain, Lei had stopped breathing and had to be emergently intubated in the ER. She was soon transferred to the intensive care unit and started on IV cefotaxime, antibiotics, and corticosteroids. In the ICU, Lei's labs were improving, but her pupils were fixed and reflexes were absent. On the 10th day of her illness, the critical care doctor informed Lei's parents that their daughter has suffered irreversible brain damage and death due to her undiagnosed and subsequently late treatment of bacterial meningitis. After careful consideration, Lei's parents decided to take Lei off of life support on a Friday morning at 7:45, and Lei passed away a couple of hours later at 10:29 a.m. Here is a diagram of our pathoflow that shows how bacterial meningitis progresses, the signs and symptoms, and different treatment options and patient outcomes.
Now that we finished the case study, we're going to give some background on what meningitis is. It is the inflammation of the membranes that protect the brain and spinal cord, also known as the meninges. The causative agents are most commonly identified from the following microorganisms: Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza. There are several different risk factors for meningitis, the most preventable being vaccinations. And then moving on to age, infants are at a greater risk for developing meningitis due to their underdeveloped immune system. Workplace exposure, for example, microbiologist. Meningitis flourishes where a large number of people gather, so it's most common in college dorms, military bases, and boarding schools. Those with a weakened immune system will not have the ability to fight off infection-causing pathogens. And then certain medical conditions such as pregnancy, HIV, cancer, diabetes, and those who use immunosuppressant drugs.
Meningitis is very serious and can cause death without treatment, therefore it is important to be able to recognize the signs and symptoms. Meningitis can vary in clinical presentation depending on the age and immune system of the host. Early symptoms may be similar to the flu and may develop over several hours or over a few days. Typically, symptoms of bacterial meningitis develop within 3 to 7 days after exposure. The most common symptoms of meningitis for individuals over the age of 2 years include fever, headache, and neck pain or stiffness. Other symptoms include nausea, vomiting, photophobia, skin rashes, seizures, and altered mental status. Signs and symptoms are less evident in newborns and infants. They can present with and without fever or hypothermia, decreased oral intake, altered mental status, irritability, inactiveness, and bulging fontanelles.
Prompt identification of the etiology of the meningitis is essential. When the patient presents to the clinic with symptoms indicative of meningitis, a thorough health history should be taken. The provider will perform a lumbar puncture and order a complete blood count. The components of the cerebrospinal fluid will provide information to clearly identify the characteristics of the disease to be treated. CSF infected with bacterial meningitis will have a cloudy appearance, possible low glucose content, mild to marked elevated protein content, high white blood cell content, and will produce a positive Gram stain. Acute onset of symptoms commonly indicate bacterial meningitis rather than fungal or viral origin. A series of physical assessments are traditionally performed and include a test for nuchal rigidity or neck stiffness. Koenig's sign and Brodzinski's sign are also used as positive indicators of meningitis.
When the proper testing and laboratory values are completed and acute bacterial meningitis is suspected, empiric antibiotic therapy should begin promptly and should not be delayed pending diagnostic results. Targeted antimicrobial therapy may begin in adults following a positive CSF gram stain result, and the antibiotic chosen must have bactericidal activity in the CSF. In most cases, children admitted with bacterial meningitis also receive intravenous fluids for dehydration or hypovolemia. The addition of dexamethasone may be considered as steroids have anti-inflammatory effects. For antimicrobial therapy, the duration will depend on the pathogen identified. For S. pneumoniae and H. influenzae, a 10 to 14-day regimen is recommended. For N. meningitis, a 7-day regimen is recommended, and for gram-negative bacilli, a minimum of 3 weeks regimen is needed.
Due to the overload of bacteria within the meninges, a course of treatment is primarily a regimen of antibiotic medications. The antibiotics chosen for treatment are individualized per patient, are determined based on the gram stain and structure of the bacterial pathogen. For Streptococcus pneumoniae, a gram-positive pathogen, a third-generation cephalosporin and vancomycin will be used. For Neisseria meningitis, also a gram-negative pathogen, a third-generation cephalosporin, as well as penicillin, dependent on the strain. For Haemophilus influenzae, a gram-negative pathogen, a third-generation cephalosporin will also be used. Though third-generation cephalosporins inhibit cell wall synthesis in gram-positive and gram-negative pathogens, though no cell wall means no structure for the bacterial cell, which inhibits growth.
Moving on to patient education, here are things nurses can teach their patient to reduce the risk of contracting bacterial meningitis. 2 vaccines available in the U.S. are meningococcal conjugate and serogroup B meningococcal. Nurses should also encourage patients to wash their hands with soap and warm water or use hand sanitizer. Remind patients to cover their mouth and nose when coughing or sneezing to prevent transmission, as well as stressing the importance of living a healthy lifestyle, which include getting the proper amount of sleep, an adequate balanced diet, and incorporating physical activity in their routine, which all contribute to immune system support. Things patients should avoid include active and passive smoking, which increases the adhesion of bacteria to mucosal cells. As this disease is spread through direct contact and droplet, nurses should educate patients to avoid close contact with infected individuals and sharing things such as drinking glasses or utensils. It is also important to complete the whole course of antibiotic therapy to prevent the development of antibiotic-resistant bacteria. Finally, nurses should educate their clients to not ignore the symptoms and seek medical attention, as catching the disease in its early stage can prevent complications. In conclusion, while bacterial meningitis is a well-studied disease, it is still a concern to public health. The many early-stage manifestations of bacterial meningitis makes it difficult to diagnose. However, prevention, transmission, and complications of the disease can be reduced significantly through the use of vaccines and education of personal and public health practices. While there have been major advancements in bacterial meningitis prevention and treatment, improvement can be done in early-stage detection and increasing the spectrum of bacteria that vaccines present. That has been our presentation on bacterial meningitis. Here are our references. Thank you guys for your time.
Paulo!